this next part of the correcting upper body dysfunction video, home exercise program, we're going to go through and look now at the stretching or lengthening techniques. So we've done our release techniques, we've done our mobilization techniques, we've done those. Now we're going to lengthen those muscles that we addressed as being short and overactive. And again, we're going to now take them to a new length. We're going to try and optimize that length of those muscles. Okay, so we're going to take them out of that shortened position that they're in, and again try and return them back to the normal or optimal length. Okay, so the ones we're going to go after, only 2 stretches to go for really here. So the first one I'm going to show you is the child pose. So that's mainly going to address those big lat dorsi muscles. So they're the ones that's going to contribute to that arms fall. They play a huge role in contributing to that arms fall sign. So one of those main signs of dysfunction for upper body. So that's what we're going to go after first, and I'm going to show you the child pose stretch. And what this also does, this stretch does hit quite a lot of muscles. It also gets those rhomboid muscles. So if you remember when we did that release technique between the shoulder blades, it will also get the levator scapula. So that muscle that tends to get really tight and irritable in the kind of like in that kind of cervical spine, in that kind of neck area. So it's going to get that. It's also going to get some other muscles like our subscapularis, which sits on the underside of our scapula, which it's hard for us to get with, we can't really get in there with a massage ball or foam roller, just because of the position where it is. It's we kind of have to go through our kind of almost like through our armpit to get there. It's not going to be very nice. There are some tools you can use to get in there, but that is a little bit more specific. Normally we need like a bit of manual therapy to release those. So, but again, we're going to address what we can do, and we can still lengthen that muscle as well by doing the child pose, because again, that muscle does rotate the arm in. So we can still get this with this stretch. We can also get a little bit of posterior deltoid as well when we do this. So for the child pose, what we're going to do, you've probably seen this before, it's very straightforward. We're just going to sit our backside back towards our heels, or as far as it can go. Doesn't matter if you get stuck here, that's fine. We're going to go back as far as we can go, and all you're going to do is you're just going to reach out in front. Okay, and again, you can place a little pillow underneath to rest your head on it if you want to. That's absolutely fine. And I'm going to reach my arms out in front, and what I'm also going to do is I'm going to turn my thumbs up to the ceiling. And the reason I'm doing that is because if I do that, we're going to rotate our shoulder joint out, which is called external rotation. And our lats, so these big lat muscles, they're an internal rotator. And again, it's those internal rotators that are really driving that arms full sign. So if I do a bit of external rotation by putting the thumbs up, that's going to help to lengthen them and stretch them even more. Okay, so I'm going to reach as far forward as I can. I'm going to try and lock out my elbows, rotate my thumbs up, and again, I can just look down and hold it there. Now all I'm doing is I'm just going to go to that first point of stretch. Okay, so that first point of tension, and I'm just going to hold it there. Okay, so that's the position I want to be in. I'm just going to hold it there, keep it still.